workshop for the month of May. It is Vape 101 with Natalie, who is presenting here with us today from the Oakland County Health Department. We're excited to have her join us with this great information many of you have asked about, so we're happy to share it. Just as always, as a reminder, please make sure we are muted throughout the presentation. We are asking that all questions are saved till the very end. You're more than welcome to put them in the chat so that you don't forget it. But I will make sure at the very end we will address all questions just to make sure we know that there's a lot of information that happens during this topic. So we just want to make sure we have time to cover it all. There is 1.5 McBAPs specific McBAP credits, continuing credits available if you remain here for the entire time and complete the evals at the end. We do have 2 evals today, so both of those links will be provided to you in the chat at the end. If you don't have access to the chat, do not worry. I will make sure at the end of the workshop here today, I will send out an email either tonight, tomorrow morning, to make sure that you have a chance to review that. Our evaluations are open until Friday at noon, so it gives you time to be able to complete that as needed. Um, I'm blanking on if there's anything else now that I'm used to having Kaylee here with me. She's not here with me tonight, so I'm forgetting. This will be a specific one. This is specific, as I saw in the chat, the quick CEU question. So with that being said, I'm going to turn it over now to Natalie. We'll get started here.
Thank you, Anna, for the warm welcome. Like Anna stated, my name is Nadli Arabo. I'm a health educator with the Oakland County Health Division. And today we are going to be discussing the truth about electronic cigarettes. Our presentation is called Vape 101. So our goals for today are to describe how electronic cigarettes operate and also be able to visually identify them. We have some pretty cool ones in this presentation, some new up-to-date ones. We're also going to list some public health consequences related to safety and health concerns using e-cigarettes. We're going to explain why the youth are so attracted to these products. We'll also describe that e-cigarette climate in Michigan. And then right at the end, we'll have a list of e-cigarette related resources. So we do ask that you hold any questions you have until the end. That's when they'll be addressed, but you're welcome to pop them in the chat. We'll just address them right at the end. So we'll start out pretty easy, very basic. We'll just describe how an electronic cigarette works and some of its components. Let me see if I have a laser pointer. I do. Okay. So right up here is our mouthpiece. This allows the user to inhale the contents from an electronic cigarette. This is a very basic generic model. They're all pretty much built the same on the inside. Right over here is our battery. Some come in disposable. They're also rechargeable, and there's some that are refillable. Now we have our cartridge. Now the cartridge is right over here. Now this cartridge is filled with liquid nicotine, flavors, and other chemicals. Now the coil is right over here. And when that is heated up, that's what converts the contents that are in our cartridge into an aerosol. And I do want you to pay attention that I said aerosol because I'll be discussing that in just a moment. So some of the basic ones that are available, we have disposables, we have our cartridge and our tank systems, and then also some common chargers. These are just some generic looking ones. I mean, they haven't changed drastically from this. These ones are still available, just some of the shapes might be a little different, some of the designs and colorings. But what we do want to make note of is that the chargers look very similar to like a Samsung and an Apple charger. They're meant to be universal. They're meant to be plugged in virtually anywhere. So that is why we see so many youth with them in the schools, because they are just plugging it into their laptops or plugging it into the walls. They can disguise it as pretty much any product because they can be pretty much shown as anything. So having these common chargers makes it super accessible to our youth and also super accessible to the user. Now, we did state that it's an aerosol and it's not a vapor. I know they're called vapes, but they're actually aerosols because there's no water vapor inside of an electronic cigarette. So that e-cigarette allows the user to make these large clouds that they think is just water vapor, but that cloud mixture has so many different chemicals that are either present in the e-liquid before or produced during that heating process. So the aerosol is a mixture of liquid particles suspended in gas, which can contain many chemicals. So it's an aerosol like spray paint, hairspray, fragrance sprays, anything like that, but it's not a water vapor like water that we're, boiling in a tea kettle. So to clarify a little further, what is an aerosol and what's in it? Nicotine is found in over 99% of our e-cigarettes, which we know nicotine is highly addictive. It comes from a tobacco plant. We've been finding them in virtually all electronic cigarettes, even when they state they are nicotine free. Now, one of the key components we want to talk about is diacetyl. Diacetyl is responsible for popcorn lung. And then right at the end, I do have a couple pictures on what that looks like. It's linked to, so popcorn lung is a lung condition. It's called bronchitis obliterans. Sorry, I'm butchering the name. I haven't gone to med school. But it is a serious irreversible lung disease like COPD. E-Valley is also super common and linked only to electronic cigarettes. E-Valley had a huge outbreak in 2019 and led to so many hospitalizations. The CDC was saying that it's because of the vitamin E acetate, that ingredient that's sometimes used in the THC-based vapes. That's why we were seeing such a huge outbreak in E-Valley. So these are just some of the chemicals that we have been seeing in electronic cigarettes. Many of these are also found in traditional cigarettes, and e-cigarettes do produce an aerosol that often contains that propylene glycol. It contains glycerin. It contains flavorings and nicotine and other harmful chemicals and substances, which we know cause cancer. Flavorings is one of the things we will focus a little bit on today. I know the majority of electronic cigarettes are flavored, but we'll talk about why adding flavors to electronic cigarettes is super hazardous and dangerous to our bodies. We do have a very quick video we're going to watch. I know it's very elementary level, but I think it does a great job explaining the difference between water vapor and what an aerosol is. So that quick 30-second video just shows us the real difference between water vapor and an aerosol. We're seeing that the water vapor is clear, it's liquid, it's clearly there's nothing else in there. We can see that the aerosol contains a cloudy mixture, and that's what all those particles are, and that's what's going inside the bodies. To switch gears, what an electronic cigarette isn't, they are not approved by the US FDA as a quit tobacco device and shouldn't be marketed as such. I know there are users who swear that electronic cigarettes help them quit smoking. That's great, but the FDA does not market it as such as a quit tobacco device. In fact, we're seeing so many studies that individuals who quit using traditional cigarettes are actually reducing the chances of them quitting smoking entirely when they switch to electronic cigarettes. And this could be in part of some of the flavors that are in there. It tastes better. You don't smell like a traditional cigarette user. That harshness that's in the back of your throat from smoking a traditional cigarette also isn't there. There isn't that discomfort from others from being around someone who is smoking. You're not giving off that odor. You're not producing, that toxic fumes that come from a traditional cigarette, but what's actually coming out of an e-cigarette is much worse. And we're going to discuss that in a bit. So that's why the FDA does not approve it to be a quit tobacco device. To take it back to the beginning, it all started with Juul. So the tobacco giant Altera, which was formerly known as Philip Morris, now owns Juul. He bought out Juul in 2018, December of 2018, for about 35% of the company for $12.8 billion. The company was starting to go under. So now the same company that owns the entire tobacco industry also owns Juul. And they were one of the first pioneers with electronic cigarettes. They're the ones who really got it rolling in society. So when they wanted to create a device that was attractive to users, they created this USB style device that they knew would be eye-catchy. They knew that users would be attracted to it and might even attract a younger population. So they really tried to plug that into social media. They really tried to get their advertisements out there to get that device to be the next IT product. Some of their flavor pods have actually been not discontinued, but banned. So I believe it's the ones right here at the bottom. They are no longer allowed. I'm sorry, it's the green and brown ones, are menthol ones. They are no longer allowed to sell those because of the menthol flavor bans, but there are many counterfeit versions that are still on the market today that can be interchangeable with those Juul devices if they still have them. So e-juice, this is the refillable droppers for vape devices that can be refilled. On the left-hand side, these are some of the older e-juices that were on the market. We can notice that they look more like an eyedropper. They aren't very appealing. They look honestly toxic. They look like they're for like a chemistry lab. So what they did is they revamped them to the ones on the right. So these are the newer versions that we're seeing out. They are a little bit bigger, so they're about 35 mLs per bottle. They're more attractive, better packaging. Currently on the market, there's over 8,000 flavor combinations to date. So these new e-juices are really gaining popularity amongst the youth because of the new flavors that are constantly coming out. So this just shows the dangerous levels of nicotine. So between a cigarette and a pod, we start out very easy with a pack of cigarette. It has about, a pack has 20 cigarettes. That's about 20 milligrams of nicotine. So we can note that one cigarette is about 1 milligram of nicotine. One Juul pod is about 41 cigarettes. So it's about 2 packs of nicotine, 2 packs of cigarettes. And then one puff bar, I think they're now just puff. They're going through a trademark. That one is about, I cannot see my own numbers. That's about 50, 60 packs, 50, 60 cigarettes. So it's about 3 packs of cigarettes. And then we have our Sororum pods, and those are about 90 cigarettes. So that's kind of that comparison. So it's about 90 milligrams of nicotine. So this is our National Youth and Tobacco Survey. This survey is done every single year. And what they do is they talk to middle schoolers and high schoolers, and they try to see what's going on. What is the youth using today? What tobacco product is super popular? What isn't? We have noticed a decline in e-cigarette usage. In 2023, we were about 2.13 million teens were using electronic cigarettes. Now it's about 1.63 million. That was as of last year. The new data should be coming out this October or November. So once we get that information in, we'll also update it. So seeing this decline has been a huge success for us. We are also noticing that e-cigarettes have declined in their usage. So in 2023, they were at 7.7% of teens prefer to use an electronic cigarette, where just last year it was about 5.9%. But something interesting has also happened. These nicotine pouches have entered, like the kids say, they've entered the chat. So those are now in the top 5 of what the youth are preferring to use is these nicotine pouches. They are still remaining low with usage at 1.8%, but it's astonishing that they're even over 1% because in the last few years, they were one of the bottoms of the poll. And I'll show you one of our charts in just a minute. But they were just so low on the poll that they weren't even considered to be something that was, even in the teens world. So this chart does show e-cigarettes, some of the results that we've been seeing. We are noticing that the tobacco products are still hitting the lowest that we've seen in years. So just last year, seeing that it went from any tobacco products, so youth using just anything, went down to about it was 2.8 million in 2023. Now it's at about 2.3. E-cigarettes, we were at 2.1. We're now at 1.6. Huge decline. But what's interesting is that we're seeing these pouches that are now in the market and that they're actually surpassing cigarettes. So teens are preferring to use these nicotine pouches over traditional cigarettes. And still the most common brand is Elf Bar. Now this is nationwide. I know Elf Bar may not be super popular here in Michigan, but nationwide it is one of the most common and preferred e-cigarette brands. But yet we're still seeing Breeze is on there, Juul is on there. We're seeing that more than 1 in 4 teens are using electronic cigarettes daily. And 87.6% of our teens are preferring for their electronic cigarettes to be flavored. So this is the chart I was talking about, where we see the ranks over the last year on what our teens are preferring. So any tobacco products, that's at 8.1% of teens are using any tobacco products in middle and high school. E-cigarettes are still the highest preferred option with 5.9%. Nicotine pouches is at that 1.8%. Cigarettes are still on there with 1.4%. And then it also mentions cigars, smokeless tobacco, hookahs even on there, and even pipe tobacco. So those options are still relevant to teens and they're still reporting usage. But seeing now that nicotine pouches are surpassing cigarettes is very concerning. We are attributing some of that to social media. We do know that these pouches are gaining a lot of popularity on TikTok, on Instagram, with teens seeing a lot of those ads. They're also seeing a lot of rewards programs for those ads. So it's definitely gaining popularity. A lot of Instagram or TikTok, whatever celebrities are making more videos about them and how they're getting free, grills or whatever they're giving out. So it's gaining popularity because of their rewards programs, because of all their videos that are coming out. So seeing that huge increase has been slightly concerning for us. For the flavors, in 2023, the CDC did state that one of the most common used flavor amongst the youth were fruit. Those were ranked at about 63.4%. We also saw that candied desserts and other sweets were preferred amongst our youth at 35%, whereas mint was about 27% and menthol was still at 20% usage with our teens. So this is the Elf Bar. It is one of the most, it is the most preferred product, most preferred vape amongst our youth nationwide. So it is disposable. It is about 5,000 puffs per device, which is about 400 to 500 cigarettes. They come in about 40 milligrams of nicotine. As of March of 2023, they were going through a lawsuit trademark situation. I don't have a huge update on what is going on. There was another company trying to copy their name. We've seen that before with other brands. So we did want to make note that they did have that lawsuit, but it looks like they're still, preferred number one amongst our teens. Now, as much as these tobacco companies will say we don't try to target teens and we don't try to target the youth, we see products like this coming out where it comes as a highlighter and it's 4,000 puffs. Now, these were all over the news. I think it was September of 24 or 23 when they first came out. They are called High Life. They are made to look exactly like a highlighter. They are made to be discreet and carried at school and to fool the common eye. They can also, since they're disposable, they can just be thrown out right after. So these were created just a couple years ago. They hit the market. They're about 4,000 puffs, which is about 10 to 14 packs of cigarettes. And then we also see some like the ones on the left, which look like a Coke bottle. And those are about 35 packs of cigarettes because they have 10,000 puffs. And they're always going to deny that they're targeting our teens. And then we'll see some products like these come out where it looks like a Minion or a Care Bear or SpongeBob. And we know that this is targeting the youth. This is not a product. I mean, I'll be honest, my dad's a war vet. I can't imagine him holding a SpongeBob vape. Like, it's not going to happen. It's not made for that generation and that population. These are made specifically for the youth and for teens to use. And taking note that even the SpongeBob one comes in 7,000 puffs. The flavor is strawberry. I mean, and even the price is so affordable and low. That's how they like to enter that market for our teens. These are some of the newer ones that we've been seeing. So we have our food product that's in blue, and then we have the copycat, which is in this purple color. So these are vapes, but what they do, these ones, I'll use my Stanley cup here if it shows up on camera. So what they're supposed to do is at the bottom of your cup, they attach to the bottom of your straw, which is on the inside of your glass. And what they're made to do is they hook up on the bottom of your straw where you can put it right inside your water bottle. And while you're drinking water, you're actually vaping because they're this big and they're made to attach to your straw. So those are some of the new ones that we are seeing hit the market. That is why we are seeing a lot of schools banning water bottles that are not clear and that are, like the Stanleys that are fully coated, that they are banning them because they want to see what these kids are putting inside their bodies. So these are just some of the copycat flavors. We've seen that 81% of the kids who start using a vape product are starting with flavored products. So it makes sense why they're choosing something that has a flavor, and that tastes good. 99% of the e-cigarettes that are sold on the market contain nicotine. So 100% of these, they all contain nicotine. They've also gotten super catchy with their slogans. There was one, it was called the Aqua Rainbow, and their slogan was Vape the Rainbow, which it was made to resemble the Skittles slogan, which is Taste the Rainbow. So they are truly copycats of original products. Some of the other ones that are on the market and preferred by teens is pre-filled and refillable pods. So these are actually number 2 preferred by our teenagers. We're seeing that this one right here in the middle, the Vupu Drag, some common features of it is that it has that smooth 360-degree airflow. So when you're inhaling the contents, it doesn't have that roughness in your throat. But you have the option to switch between the fire setting or auto draw. So if you are a former traditional cigarette smoker and you want that sensation again, you have the option to switch. to have that feeling or to have that smooth airflow. These are the ones that are also responsible for those super dense clouds. And we were seeing that some of them have battery lives up to 10 hours. And I know there's some right now that can go a little bit further than that. And then the number three most preferred amongst our youth are these pods and tanks. So these are responsible for those really large clouds. They are button triggered, and they also allow the user to stop and start the device. But after 8 seconds, when that button is held, it does automatically shut off, for protection from exploding, or, they want to protect the user. It's very funny how they created some of these. Now, some of these devices are touchscreen. They have the battery life on there. It'll tell you how much e-juice is on there. There's even some devices right now that are a full iPhone. I mean, you can go on social media on there. You can play games on there. The ones here in the picture are fairly inexpensive. They're about $29. The ones that are more loaded and have more features, those can go up to about $300-400, which is what we've seen some teens spend on these devices. Now, some of the designs that are out there, there's these sleek and discreet designs. So the Sororan Drop, which is made to resemble a water drop, Sororan Air, which was made to resemble an iPhone, and the Smoke Rolo badge, which was made to resemble a police officer's badge. Now, all three of these are customizable, so it allows the user to kind of pick a device that matches their personality. They can also be vinyl wrapped and custom ordered. And they're also trying to be discreet where it's kind of hard to see where the mouthpiece is. Like the Sororan Air, the mouthpiece is right up here. The Drop, we know it's right here. And same with the Rolo badge. But they tried to make it discreet. They tried to make it like it can fit in the palm of your hand or in your pocket so you can hide it from who doesn't need to see it. We're going to switch a little bit to talk about nicotine gum. I'm not going to go super heavy into it, but these are just some of the nicotine gums that are on the market today. This is actually what I've seen some of my high schoolers do. So these nicotine gums, they're not like that pepper nicotine gum that you get from CVS. That's 7, 14, 21 milligrams. This nicotine gum comes in different flavors like pomegranate, mint, cinnamon. So it's made to be attractive and it's made to taste good, kind of like e-cigarettes. So I've seen a lot of my high school students chew this product. So they'll have nicotine gum in their mouth during class, and then when they can kind of sneak off between classes to actually use their electronic cigarette. Another product I do see them use is these nicotine pouches. A lot of Zyn is going around. There's also Velo. So these I've also seen my high schoolers use. They're using them thinking that they may not have as much nicotine as an e-cigarette, but we have found that these Zyns contain as much, if not more, nicotine as an electronic cigarette. It just depends on how often the user is using their electronic cigarette. So with these Zyns, they're already formulated with that amount of nicotine per pouch, and then you can, kind of do that, equate to how many puffs someone is using a day or an hour or whatever. So a lot of teens are switching to Zyn pouches because they're thinking it's helping them stop using electronic cigarettes, but we're finding that right when class is over, they're spitting it out. They're finding a spot that they can go and use their electronic cigarette. In high school, this is one of the most popular vapes that we'll see. It's always the ones that contain marijuana, so THC vapes. Those are super common. That is what we're mostly confiscating in high school. We have seen a little bit in middle school, but mostly high school. We're seeing that a third of middle and high school students are reporting to have used an electronic cigarette that has non-nicotine substances. And 1 in 3 youth have used marijuana with their Juul device. Now, once again, this is one of the most common ones that we're confiscating in high schools. That's where we're mostly seeing it as. We don't see a lot of traditional vapes in high school, but in our middle schoolers, we do. So just to be aware that the THC ones have entered the market. These are some of the other THC devices that are also in the market. Um, Delta, which is right here in the middle, is a disposable device that it's available at most of the vape shops. They're mostly sold at dispensaries. And then one I do like to make note of is this Puffet device that's been around since 2012. It is a marijuana vaporizer, and it looks just like an asthma inhaler. So now it's gotten a little bit more tricky trying to distinguish between, does this student have asthma or is this student using a THC device? Because this THC device can hold a quarter of a gram of, loose leaf marijuana in there. And we have seen, cases of it in Oakland County and in our school district. So some of the schools are revamping some of their policies, whereas, any inhalers need to be held in the office. If a student needs it, teachers have these walkie-talkie devices now where they can just alert the nurse or alert an officer to grab the nurse to come and bring that student's asthma inhaler because of the huge amount of THC vapes that we are seeing in schools. One of the last THC products I do want to make note of are the gummies. They are everywhere. So, if there's an adult in the house that is using them, we always recommend that you keep them locked up, safe, away from children and pets. We've actually had elementary schools contact the health division to come and do these presentations because we had an elementary level student take their parents' gummies, bring them to school, and pass them out, thinking that it's just, gummy bears. But in reality, they were THC products. And now we're starting our education even earlier. That was first grade. However, some of our curriculums don't go as early as first grade. So we start our education around fourth and fifth grade. So just be mindful if you do need a lockbox or a lock pouches, feel free to reach out to me. I will be dropping my email and all my contact information in the chat. And I know Anna's going to send it out. We give them out at the health division for completely free. Just message us that you need some. We can send you that link. You can request as many as you need. And one of the last devices that I'll talk about is these health vapes. So these were super popular during the epidemic. They were being advertised as like your chill vape, your stress-free vape, excuse me, your melatonin vapes. They were made to help you relax, but we actually found traces of nicotine in them, even though they were being advertised as nicotine free. There is no evidence that they are nicotine free, but there's a lot of evidence that they contain nicotine. So just to be mindful that even though they're advertised as like a healthy alternative to vaping nicotine, there are traces of nicotine in them. So with the youth epidemic, we have our former Surgeon General. Now, this is our Surgeon General from 2018. I know we have a new one that's being appointed this year. He had stated that he is officially declaring the e-cigarette use amongst our youth an epidemic in the United States. This was declared about 7 years ago. To this day, it is still holding firm. It is still holding strong. We are seeing that the new Surgeon General is looking into this vaping epidemic. We haven't heard an official statement yet, but we know that it is coming this year on how the administration can really assist with this epidemic. Now, we do want to switch a little bit and talk about the adolescent brain and why vaping has really impacted our youth. So we do know that the human brain matures around 25 is what we like to say. That's what we tell our teens. Nicotine addiction is more common and more likely the earlier one initiates. So when a user is starting in their teen years, their brain is developing. Anything new that they're introducing to their body, their brain is like, oh my God, this is so exciting. I like this. And that's why they get hooked a lot faster. And because of that, we have seen a lot of mood disorders, lower impulse control, attention and learning problems. And these problems can also carry on into adulthood. And even after a user stops using any nicotine related products. Some of the common myths, I know I've discussed a few of them, but just to reiterate, there is no water vapor in an electronic cigarette. It is purely an aerosol. It's not just flavoring. That one is super important, and I like to talk about it with my teens. So flavoring should not be allowed to be put into electronic cigarettes because the FDA does not recommend any flavor to be inhaled, only to be digested. And I'm not going to get super, biological right now because I'm sure we all know our digestive system and our respiratory system. When you eat something with a flavor, we know our liver takes out all of those toxins. However, when you inhale a product that has a flavor in it, all those flavors are being trapped in your lungs. The liver does not work with the respiratory system, so everything is just getting trapped there. So that is why they do not recommend any flavor to be inhaled and only to be digested. Some of the common signs of addiction. Now, I do like to show this slide when I'm talking to my teens. It's also a way for us to this is how we can usually tell when youth are addicted to their vaping devices. We notice their mood is different. We notice they can't focus on anything the teacher is talking about. The entire time they're watching that clock, they're trying to see when is the next time they can sneak off to go use their electronic cigarette. So they're kind of losing control of some of the things that they want to do because they feel like if they don't have that e-cigarette on them, they cannot go on with their daily function. So that's what leads them to that clinginess. It's like the phone to them. Like they have to have it on on their body 24/7. And we're also noticing that they are higher risk when they can't stop themselves from vaping in places that they know they can get caught. We've had some students just mindlessly start vaping while I'm doing a vaping presentation in schools just because they're not even thinking that's what they're doing. There is just part of their routine. So we've had to stop the presentation, had them, escorted out of the classroom, but that's how much it controls their body and it controls their brain. So to talk about the rise in electronic cigarette usage, we're noticing that they are targeting and marketing to teens, of course. The tobacco industry uses their prices, promotions, coupons to make e-cigarettes cheaper to the consumer. Even during COVID, there were some companies that were advertising as like a safety kit, where if you purchased one of their vapes, you also got masks, gloves, sanitizer for free. They were even advertising as don't share your vapes, protect yourself from COVID, everyone get their own vape. So some of those types of marketing and promotions were really catching the user's eyes to really push their product, but also the incentive was what people wanted. So what they were trying to do wasn't it wasn't practical. It was not working at all. They were trying to protect someone from the COVID harms, but not from what these electronic cigarette harms are doing to their bodies. Now, these e-cigarette sales are responsive to price changes. So when e-cigarette prices increase, we do see sales decrease, vice versa. We see that the flavors found in e-cigarettes are super attractive to the youth. Once again, there's over 8,000 flavor combinations on the market today. And there's also a lack of regulation on how this industry grew at such exponential rates over the last few years, especially in our youth market. They have declared that the youth are the next generation of tobacco users in the tobacco industry. So making sure that they are still interested in their products is very important. And especially with social media, we do see that a lot of e-cigarettes are making frequent appearances on social media, news feeds, and timelines. We saw that when Juul came out, they spent over $1 million to market their product on just the internet, which was insane. In 2015, on X, which was formerly known as Twitter, there was a monthly average of about 30,000 tweets by the end of 2017. So between 2015 and 2017, there was a monthly average of about 30,000 tweets related to Juul to really capture that audience. But what we've now been hearing from our youth is that they are starting to hear ads that are anti-vaping. So on Spotify and on TikTok, they get little advertisements that are, hey, if you're having, this health condition or you feel like you can't stop, here's some resources to help you stop vaping. So that is a positive we are seeing out of social media today. But we are still having these influencers still promoting their products. There's so many movies and TV shows that are still pushing electronic cigarettes. Now, just as of a year ago, we saw that 73% of our youth had reported seeing a vaping related ad on social media. There was a study that found nearly 74,000 of these tweets were about e-cigarette just in a 2-month period. This was just in the last year. And some more of the entertainment. I mean, we're seeing this throughout all movies and TV shows, magazines, music videos. I mean, what they're trying to do is create that new sex appeal that e-cigarettes can do. Whereas it used to be traditional cigarettes, they're trying to revamp it to be these e-cigarettes. We're seeing a lot more celebrities advertising it than we would have before. Now to switch gears on the menthol ban that is still ongoing. The FDA announced back in April of 2021 that it's going to begin the process of banning menthol tobacco, cigarettes, and cigars. Massachusetts and California have banned all menthol products throughout their states. However, it doesn't include e-cigarettes. Now, these advertisements are still promoting that they can sell menthol flavors, and only closed pod systems like Juul have those flavor restrictions. Now, this ban is still delayed. Michigan is working to ban menthol products. There's a big fight going on with it right now, so it hasn't fully taken into effect. We did want to make note that banning menthol flavored cigars will save at least 45,000 American lives annually and will keep our young people from initiating. Now, I know some of this information has been super negative, but we do want to talk a little bit about some of the health concerns that are related to vaping. So with just vaping, we're seeing, of course, an increase in nicotine addiction, mouth throat irritation, coughing, worsening asthma. If a user is experiencing any of these or even a new concern, the CDC does recommend, of course, seeing a medical provider right away and calling local poison control. And if there's a symptom you're experiencing that is not on their list, you are able to report it to the CDC site and they can add that as a warning. Now, the American Academy of Allergy and Immunology website did state that people using e-cigarettes are twice as likely to start having breathing problems. We are seeing an increase in asthma and ongoing bronchitis. Now, I know it's a lot of negativity, but to switch to some positivity, I like to include this slide to show what can happen to your body once you stop smoking. And I mean, within 20 minutes, your heart rate starts to drop to normal levels. Within 12 hours, we see our blood, that CO, that carbon monoxide, CO that's in your blood starts to decrease and you start to go back to normal oxygen levels in your bloodstream. Your lungs will recover within 9 months. Your taste of smell comes back. Your risk of having a stroke is it takes about 2 to 5 years to go back down. And then your risk of obtaining cancer is about the same as someone who has never smoked after 10 years of quitting using e-cigarettes. Now, something we don't usually hear about a lot is second and third hand aerosol. We all know secondhand smoke is, when you're next to someone, you're breathing in the contents from their cigarette. Um, but something that we found is happening with these e-cigarettes is third hand aerosol. So third hand aerosol is when that smoke that comes out of an electronic cigarette touches a surface that those contents from their smoke can remain there. We have seen some of those contents remain there, for a minute to all the way up to years. It depends on how often that user is constantly vaping in that area. So let's say if I vape and I vape on my computer and I do that daily, all the hazardous chemicals from my vape touching my computer will remain there and they will remain live. So if someone comes after me and they touch my computer and they wipe their eyes, their mouth, nose, ears, whatever, those contents go inside their body. And we're considering that third hand aerosol. This could also happen when a user just, briefly uh, does it to an object and someone else comes by and touches that object and does the same thing, into one of the openings in our body. They could still receive third-hand aerosol and still obtain those toxic chemicals. So we always advise that if there's a user who is mishandling their electronic cigarettes and they're vaping on any devices or near anything. It could even be an article of clothing. It could be a laptop, could be a desk. It could even be food, that they take the precautionary actions other than food. Of course, wipe down your surfaces, do your laundry. If it's food, we don't recommend vaping near food just to decrease that type of contamination. So always take those precautions to remove yourself into an open area. So going outside, being away from others, just to decrease that third hand aerosol. Some more of the safety concerns that we've been seeing are, of course, explosions. They are still 100% happening. They're just not in the news. Where devices are still exploding on users. We have seen some charger dangers where chargers will catch fire. We've seen some, just typical fire and poisonings. Of course, that's always happening. And of course, there's hazardous waste and litter. Electronic cigarettes are not meant to be thrown, just in the garbage or where we usually see them on the sidewalk. They're actually meant to be disposed of in hazardous waste containers because of the e-liquid that's in there, that liquid nicotine. I have a slide in just a minute that'll talk about that and how that can truly affect a human body. Now, I do want to give a warning. I have a few slides that are a bit graphic, so if you are more sensitive to seeing graphic images, I do advise that you look away or shut off your screen, whatever you need to do. So this is a teen that we had. This vape exploded in his mouth. So just a little bit of a backstory. He was someone who's using traditional cigarettes, and his mom wanted him to stop, so she gave him a vape, thinking that would help him. Chances are his first time, using his vape, it actually explodes in his body. So when he was taken to the emergency room, they did compare it to a really close gunshot wound. He did survive his injuries, but they were severely drastic. This next image is a vape that also exploded in a user. So it actually got lodged between his C1 vertebrae, so right in his spine, right in the back. It got lodged right there, and it exploded in his mouth. He did make it out okay after he was seen in the hospital. Coincidentally, now he travels the US and he actually talks to teens about the dangers of vaping. And then our last image is popcorn lung. This one is what's caused by diacetyl, that chemical that we found in electronic cigarettes. It's usually found in vapes that are like butter flavored or popcorn flavored, anything like that. That's where we found popcorn lung. And popcorn lung, what we can note is that it it's supposed to look like popcorn because our lungs are supposed to be smooth. They're supposed to be a solid. So when they look fuzzy like this and that they're broken up and they're all these like little pieces, this is what we consider popcorn lung. All right, no more graphic imaging. So the dangers of liquid nicotine. So the reason why we say electronic cigarettes are hazardous and they should be disposed of with hazardous waste is because of that liquid nicotine that's in there. Um, so a fourth of a teaspoon of liquid nicotine is is roughly 1.8 a concentration of nicotine, and it's fatal to a 50-pound child. So we always recommend that liquid nicotine is handled with gloves on, adult supervision, adult care, and never to be around children or pets. If it does, touch your skin, your eyes, or just, if someone ingests it, we do recommend, of course, emergency room and calling poison help, um, just because of its fatality. We have had users where pets chew up their owner's vapes and then they, eventually were poisoned because of that liquid nicotine that's in there. We do want to talk a little bit about Tobacco 21. So Tobacco 21 is when Congress passed the provision to raise the legal age of tobacco sales from 18 to 21 nationwide, so all 50 states. There's no exemption to our military. They still have to wait till they're 51. Now, if a location is fined for selling to someone younger than 21, their first offense is $100. Their second offense is $500, and then their third and every offense afterwards is $2,500. Okay. So in every single school throughout the state of Michigan, they have a tobacco-free policy. So this is 24/7, 365, every single school from nursery, elementary school, all the way to our college campuses. Tobacco is not allowed on campus. And because of that, they've created so many resources. One of the first prevention programs that the health division offers is called Catch My Breath. It is a vaping prevention program that we do for grades 5 through 12 throughout the county. It's evidence-based. It equips students with those essential life skills to prevent youth nicotine use, helps students develop those decision-making skills, communication strategies, and coping mechanisms. We do this program throughout the entire county, whether it is a private school. We have some Catholic schools, public schools. Any school in Oakland County is eligible to receive this program. We are nearing the end of our programming for this year, and we will be starting again in September. We've also had some interest to do it over the summer through summer schools. So this is something we're running, all year round. Another program that we do outside of schools is called our Technical Assistance Program, which is for adults and senior citizens. We actually have this program as one of the SUD workshops next month on June 12th, same time. So what this program does is that it is designed to educate the community on how to properly dispose of their medications and unwanted medications. We also talk about where local drop box locations are, how to store medications properly away from children and teens. We don't just focus on tablets and pills. We also go into sharps. And then the last thing we talk about is the opioid epidemic and the crisis in Oakland County. And we present some of those newer facts and data related to it. So if you are interested, feel free to reach out to us. We can definitely register you for that workshop next month. And then the last programs that we do in the schools are Michigan Model for Health. So this is our social emotional health component. And we have alcohol, tobacco, and other drugs. It's available throughout all of elementary school, honestly, but we've had a strong interest in 4th and 5th grade. It's a little similar to Catch My Breath when it comes to alcohol, tobacco, and other drugs, where we do discuss tobacco, but we also go a little further into alcohol. We'll talk about, some drug misuse, and we do have the programming to present to any grade level in elementary. But one other thing that we do is that we talk about social emotional health. So we help our students gain critical skills to navigate challenges, making those informed decisions, and building positive relationships. This is one of the newer preferred programs. I know in the past, life skills was one of their number ones, but Michigan Model for Health is, super, into the schools. We're seeing a lot of teachers are teaching it, and they may want a break. So they ask the health division to come in and we do the program for them. It is fairly longer, where it takes up to 12 weeks to do the program for each lesson, but we have been able to shorten it to 8 weeks to accommodate the schools and their scheduling as well. Some resources that we have available. So the Tobacco Prevention Toolkit is for educators, administrators, parents, guardians, pretty much anyone who works with youth. It's similar to this presentation, however, it's self-paced. You can watch videos, look at PowerPoints, get more information on tobacco prevention. I use it as one of my resources. I know it'll be coming out with the PowerPoint in the follow-up email. So feel free to take a look at it and go through it. Even if you have a teen and you want to go through it with them, that's highly encouraged. My Life, My Quit, it's a tobacco and vaping program for teens. Now, these programs are completely anonymous, so they will not ask for your name, your age, or to contact like an adult or anything. What they actually do with our teens is that they'll set them up with a counselor, and they will try to help them and design a program to help them quit using e-cigarettes. So I think they do about 5 coaching sessions that are live. They can be via text, chat, phone calls. I know teens don't like to use the phone. That's those older people, but they can just send a text and get that information that they need. And then once they complete the program, they do get kind of like a certificate of completion to feel accomplished, because what they are doing is a huge deal and they should be proud of making that accomplishment. There's other websites that are very closely related. So there is This Is Quitting, Tobacco Free Kids, Smoking Stinks. All of those will be included in our presentation. So feel free to explore them a little further. We always share this slide where you can text, call, visit, or we always recommend talking to someone. So if a teen wants to talk to a trusted adult first, or even like a doctor, medical professional, that is encouraged. If they don't feel comfortable doing that and they want to remain completely anonymous, they have other options to do so. All right. Now, do we have any questions in the chat? I know that was a lot of information that I threw at you.
Thank you so much. There is one question, and it is, are there studies related to individuals who have COPD, emphysema, and stop smoking, and how it impacts compared to those that do not, or non-COPD?
We haven't looked too closely into some of those studies, but I know they do exist. If you would like, I can definitely send you some of those research that has been published regarding it. So if you want, drop your email in the chat and I can definitely forward you over some of that research.
All right, any other questions? Feel free now to either take yourself off mute, or you can feel free to also put it in the chat.
Mm-hmm. While we're answering questions, we do have a link to our post survey. You're welcome to scan the QR code. I know Anna's going to also drop some of our links, but we are available if you have questions between now and 8. So go ahead and drop them. Feel free.
Any questions?
I have a question.
Go ahead.
It's different though. We took the class, me and my daughter, in Rochester.
Mm-hmm.
We never got a certificate, so I'm sitting in it today again. But my daughter had to work, so she told me to ask, would she get a certificate or no?
I think I remember you. It was last month.
Yeah, yeah,
We didn't have a big turnout. So
yeah,
the
but
health division, yeah. No, I'm glad you're back. I'm sorry you had to go through this twice, but the health division doesn't give out the credits. But
oh,
since we've partnered with OCHN, they actually do. So you will be receiving a certificate from them.
okay,
Yeah. So you
okay,
will get a certificate.
okay. So she won't get one because they don't give them out.
That's correct.
Okay, thank you.
Mhm.
Any other questions or thoughts or comments? It's a lot of information, but great
Mhm.
information, especially with the way just the devices are now with their Stanley cups or the highlighters and
Mhm.
things of that nature. Okay, and it's lots of sounds. I don't want to assume. You can feel free
You
to
can
jump
always
off.
email us privately. If you don't feel
That
comfortable,
too.
you can always send me an email. My inbox is always open. Just give me a day or two. I'll respond.
All
And
right.
Holly,
Well,
I did get your email address, so I'll definitely send you over that information early next week.
I just want to thank you because this was a very interesting class. When me and my daughter was there, we asked so many questions.
No, you're fine. Yeah, we had a very small group that day, so it was intimate. I was like, ask whatever you want right now.
Yeah,
But thank you for coming again.
thanks.
all right. Well, I'm going to put Natalie's information here in the chat
Mhm.
as well. That way, if you guys do have questions or comments, you can ask, or with the lock boxes to reach out for, or the
Mhm.
other presentation or curriculums that were reviewed as resources. So make sure that is all there for you. And then after that, I will now then put our eval in the chat as well. I just want to make sure that those were separated so they're not confused.
Mhm.
So for the OCHN evaluation, this one is to complete. That way, if you do want the CEUs, please complete that one, and then we will get the CEUs to you. And the other one, did it all go through? Oh, I did. Okay. And then the other one is for the health division for Natalie as well for your
Mhm.
guys' experience too. So with that being said, we're going to thank Natalie for her time. Thank you so much for all this information today, especially a lot of the updates. I feel like this information, every time I hear it, there's changing of new data. Some of the exciting being that the using rates are going down, but then what is being used instead as well coming in is always new and interesting and things you never would think of pouches being the next thing. And
Mhm.
now those are, ugh,
They're
gross, but
exploding.
that's
I mean,
fine.
they're giving out barbecue grills now if you have enough rewards for a pouch. I'm like, oh, that's cool. I guess.
That's
I don't know.
interesting. Okay, college
No,
student, you find a way. You find a way.
yeah.
But thank you. We're seeing some thank yous in the chat. Awesome. So now I will
Thank you,
let you
everyone.
guys take the time. We will be here, like I said, for questions if you guys have them. Take the time to fill out the evaluation. As I said before, we will have I will send out the evaluations also tonight via email as well. Um, so that way, if you don't have access to the chat, um, that will come to you via email with the email that you use to register with. I will get
Mhm.
that to you all, both of the evaluations.